Right, so here we go. Hi, this is Lee Thurman. I'm visiting with AJ Sheek about Medicare and health insurance and that sort of stuff. AJ is a longtime good friend of mine and an incredible resource when it comes to Medicare and health insurance. AJ, thanks for spending some time today to share what you do. Tell me how you got involved in the whole health insurance world, the Medicare world in particular. Quick sort of update on your story. How'd you get here?
Hi, Lee. Thank you very much for your questions. I started off in the financial services world in 2001. I was initially a financial planner, and the interesting aspect that I can always recall about my early days in preparation for being in the financial services industry is that on 9/11, I was in a prep course for my Series 7 exam. So that's a day that will forever live in infamy with me on what I was doing, where I was, and what was going on in my world. I was preparing for another leap forward into the financial services world. I worked as a financial planner for a while. I did specialize in long-term care also. Then over the years, I got into other aspects of financial services, working with small businesses and helping them get financial loans from the SBA and other resources. As time progressed, I got recruited by a lot of companies that was doing Medicare health plans, and it wasn't a world that I'd been really interested in. But then I started thinking about it. I'm there. I enjoy people. I enjoy talking with seniors. Why not pursue this and see if it's something that will meet with my needs of interacting with people and providing services? So I succumbed to the marketing aspect of the company and checked it out. And by Jove, I actually enjoyed what I was learning. So I said, well, instead of looking at other areas of financial services, as I get back into this world actively, I'm going to focus on Medicare. A lot to learn, believe me, but it's also the reason why people need agents in the field, because it is very complicated. It's complicated to understand, but once you understand it, it can be simple. So my goal was to understand it well enough that when I engage with people, I could reduce it down into a simple communication that would help them understand and grasp the major points of it, and help them understand that even though that particular area is filled with pain, anxiety, and even sometimes fear, it doesn't have to be. And I felt that with my experience in financial services, in addition to specializing in the Medicare field, I felt very comfortable engaging with people of all ages. When I say all ages, from 65 on up, there's some people under 65 who have a disability and they qualify for Medicare. But in generally, I'm talking with people my own age, and I can relate very easily with it. And there's another sector of people that I relate well to, is because I grew up in a very rural area. Over time, I matriculated into the metropolitan area based upon my work, but I engage with people who are on Medicare and Medicaid that are financially not very well off, but also sit down and talk with millionaires. So there's a wide spectrum of people that I engage with, and I feel comfortable in all those arenas. I can go into a place that some people would call it dire poverty, and I go into a place that would be, 5,000 square foot mansions in some people's minds. So I feel at ease working with people of different ages and different social economic areas. And my goal is to engage that person so that they feel comfortable with me based upon their trust, based upon integrity, based upon my product knowledge, to help them walk through this very complicated issue of Medicare. So when I sit down with a person, I really want them to do all the talking, because when I'm talking, I'm not learning anything. So I need to get them to talk so that I can help them make decisions that are right for them.
AJ, AJ, you helped both me with my Medicare decision, which I found quite intimidating, but I know you simplified it a lot for me, as I'm sure you do for other people. But I was intrigued and excited to learn that you also could help my wife that's not yet for the Medicare. She's still a few years away, and get her set up with a great policy. Talk a little bit about what other things other than just Medicare you can bring to the table to help people out with.
There's a couple of things that I can do, Lee. It's the under 65 world has loosened up a little bit in the regulatory requirements because of the getting rid of the individual mandate, which allows people to make decisions if they're in a situation where they can have individual insurance. And what I mean by that is if they are self-employed or if they're in a small company that doesn't provide insurance coverage, they can make decisions that's not associated with employer-owned group insurance. So they can have individual insurance under 65. I can help in that marketplace because I'm contracted with a company that provides superbly good coverage, and it is an option to the ACA coverage or the Obamacare coverage at extremely competitive rates. You'd be surprised at the contrast in the level of monthly premiums compared to the coverage you get. And plus the deductibles are quite low compared to what is known in the Obamacare world.
So that kind of brings up a question that popped into my mind. Do you represent a lot of different carriers and policy types, or are you locked into a particular carrier underwriter relationship?
Glad you asked that question, Lee, because I am an independent agent. The agent that's locked in is referred to as a captive agent, and I am not one of those captive people. I represent multiple carriers, both in the Medicare world and the under 65 world. So I am totally free to help the person select a plan that is right for them. And choice of multiple carriers.
Is it okay on video for you to mention the names of some of the carriers so that people would know whether they recognize them or not?
I represent most of the major carriers: United Healthcare, Cigna, Humana, Aetna, Blue Cross Blue Shield, Baylor Scott and White, just to mention a few.
Well, those are certainly some of the premier top shelf carriers. So that's a good list. All right, AJ, thanks for spending some time with me today. I appreciate learning a little bit more about what you do. And if somebody needs to reach you, if they've got a question, I'm sure you're delighted to answer those questions. How do they get in touch with you?
You're absolutely right, Lee. My website is fillthegap65.com. That is FILL, fillthegap65.com. And my telephone number is 214-733-0652.
AJ, thanks for your time today. Folks, if you need some help with your insurance, Medicare or otherwise, AJ's the man. Take care. Thanks, AJ.
Thank you, Lee.